James Simpson and Anesthetics. James Simpson was a Scottish doctor and professor of midwifery at Edinburgh University. Simpson had used anaesthetics like ether in the past, but wanted to discover a better anaesthetic. Simpson wanted to find a better anaesthetic than ether, which was flammable and could make the patient cough and vomit. He experimented with different drugs to find a better solution. Source 1. Simpson discussing his discovery of anaesthetics in 1847. I poured some of the chloroform fluid into tumblers. Before sitting down to supper, we all inhaled the fluid. We were all under the table in a minute or two, to my wife's consternation and alarm. Opposition to anaesthetics. Simpson's discovery that chloroform was a good anaesthetic was not met with universal approval. Some Victorians felt that giving patients chloroform was interfering with God's plan. Others were worried because some patients inhaled too much chloroform when it was administered and overdosed. One famous case was that of Hannah Greener. Greener was only 15 and was given chloroform when having an infected toenail removed. Unfortunately, she died. This was well publicised and made people reluctant to be administered the drug during surgery. Source 2. Letters to the Lancet, a surgeon's journal between 1848 and 1853. It is repulsive to good taste and sound judgment that every woman about to pass through the ordeal to which she was doomed by the laws of nature should henceforth rendered insensible through the whole of the proceedings. The infliction had been invented by Almighty God. Pain may be even considered a blessing of the gospel, and being blessed admits of being met either well or ill. It is most unnatural practice. The pain and sorrow of labour exert a most powerful and useful influence upon the religious and moral character of women and upon all future relations in life. Source 3. James Simpson, paper to the Genetical Society of the 1st of December 1847. In the course of our years, our successors will marvel at the idea of humane men confessing that they prefer operating on their patients in a waking instead of anaesthetic state, and that the fearful agonies which they inflict should be endured and not avoided. Why were anaesthetics a turning point? The use of chloroform was a massive turning point and certainly saved patients who could have died from pain of an operation. The use of chloroform was also helped by Queen Victoria being administered the drug during the birth of her 8th child. The development of a chloroform inhaler by Dr. John Snow also made the administering of chloroform safer and patients less likely to overdose. However, the period between 1850 and 70 is still known as the surgery's black period. This is because patients now were asleep. Doctors carried out more complicated operations which carried infection deeper into the body and caused more blood loss. This is pre-germ theory or understanding of how to treat germs. Lister and antibiotics. Joseph Lister was a surgeon. Lister had heard about Pasteur's germ theory, and in 1864 he heard about how carbolic acid was being used to suppress the smell of sewage in Carlisle. He began to think that perhaps this carbolic acid could be used to treat microbes Pasteur had thought caused infection. Lister experimented with compound fractures where the bone sticks through the skin. Usually, this type of injury led to amputations, but Lister soaked the wound in carbolic and found that the wounds healed. In 1867, he published his ideas. Source 1. Joseph Lister. In 1864, I was struck by an account of the remarkable effects of using carbolic acid upon the sewerage of Carlisle. It prevented all smell from the lands covered by sewerage and destroyed parasites that usually infest cattle feeding on such land. The ideas of using carbolic acid for the treatment of open fractures naturally occurred to me. Source 2. J.R. Leeson. Lister as I knew him. Everything was soaked in a 1 to 20 carbolic, hands, instruments and patient's skin. Moreover, the whole scene of the operation or dressing was enveloped in its spray. It went into every nook and cranny of the wound. Our faces, coats and sleeves often dripped with it. Opposition to antiseptics. Just like Simpson's discovery of anaesthetics, not everyone's embraced the idea of using carbolic spray. This was for a number of reasons. Not all doctors believed in germ theory. They used to joke about closing the door in case some of Mr. Lister's germs get in. Nurses resented the extra work caused by carbolic and did not like the effect it had on their hands, as carbolic dried out their skin. Lister's instructions were more complex and hard to follow. Some doctors struggled to get the same results. Lister kept changing his instructions. Some doctors achieved good results without using carbolic. Source 3. J.R. Leeson. Lister as I knew him. The hospital was nursed by St. John's sisters. They referred to the extra work antiseptics gave them, the endless washing of basins and macintoshes. Why were antiseptics a turning point? The use of carbolic was a massive turning point. In Lister's hospitals, the death rate was 46% between 1864 and 66, but with the use of carbolic, the death rate was reduced to 15. By the 1890s, Lister's methods had developed into aseptic surgery, removing germs completely from the operating theatre. Hospitals began to be cleaned methodically, and by 1887, all surgical instruments were steam sterilised. Surgeons stopped operating in ordinary clothes and wore surgical gowns, face masks, and rubber gloves.